Good morning, everyone, and thank you for joining us for Webinar Wednesdays with Senior Medicare Patrol. Our February hot topic is understanding your Medicare summary notice or your explanation of benefits. So we're going to be talking about these two statements today. My name is Sunny Lawless, and I'm the volunteer coordinator for our SMP programs, and I'm going to be your host this morning. Today with us presenting are Brenda Mallara, who is a community outreach specialist in Louisiana, and also Keith Havens, who is our tri-state media specialist. And we're going to be taking questions at the end of our presentation today. So if you have something that you want to ask, just hold on to it until the end. There's also going to be a prize drawing once our presentations are complete for all of those who registered for this webinar prior to 10:15 a.m. this morning, and the winner must be present to win. Before we get started, I do have to let you know that this project was supported by a grant from the U.S. Administration for Community Living, Department of Health and Human Services in Washington. Grantees undertaking projects under government sponsorship are encouraged to express freely their findings and conclusions. Points of view or opinions do not therefore necessarily represent official Administration for Community Living policy. So who is Senior Medicare Patrol? Well, SMP, they're funded projects from the federal U.S. Department of Health and Human Services, the U.S. Administration for Community Living. All SMP grants have shared national identity through a national program name and logo. Every state has an SMP program. In Georgia, Louisiana, and Mississippi, SMP is sponsored by AdviseWell. And our mission is to empower and assist Medicare beneficiaries, their families, and their caregivers to prevent, detect, and report healthcare fraud, errors, and abuse. And we do that through outreach, counseling, and education. So before we get started with today's presentations, we do have a very quick polling question for you. We would like to know, since we're going to be discussing the statements on Medicare, what type of Medicare plan do you have? So I am going to launch the poll, and you should see it appear on your screen. So let us know if you are on an original Medicare plan or if you have a Medicare Advantage plan. If you'll go ahead and select one of those options, we'll leave the poll open for just a few seconds to see and give you all a chance to respond. Okay, it looks like we almost have 100% participation. There we go. All right, so let's see. It looks like 50% of you said yes, you are on an original Medicare plan, and 17% said no. 33% of you are not on either. Well, that's some good information because we're going to be talking about the two different statements that you're going to get from Medicare, the one that you get from Medicare if you're on an original Medicare plan, and then the one that you'll get from your Medicare Advantage plan. All right, so I'm going to turn things over now to Brenda, who will get us started with the first part of our presentation today. Brenda?
Thank you, Sunny, and good morning, everyone. So we continue here with our presentation, and it's what is a Medicare Summary Notice, or an MSN? Well, the Medicare Summary Notice is also known as an MSN, and it's a statement that people with original Medicare receive. Medicare mails the MSNs out every 3 months for their Medicare Part A and Part B covered services. If you don't receive services or medical supplies in that 3-month period, you will not receive an MSN, okay? And the MSN shows all the services billed to Medicare for you, both Medicare A, which is inpatient, and Medicare B, which is outpatient. Next slide. What is an explanation of benefit, or an EOB? Well, the explanation of benefits is a notice that people with a Medicare Advantage plan, Part C or Part D prescription drug plan receive after they receive medical services or supplies. These are mailed out every month depending on which Medicare Advantage plan you belong to. Also, all EOBs show the same information, but the layout and other specifics may vary by the different plans. Next slide. So these statements are not bills. The Medicare Summary Notice, MSN, and the Explanation of Benefits, EOB, these are not bills. These are just records of what services or products Medicare has paid out on your behalf. It is very important that you review your MSNs or EOBs to make sure that the information on them is correct. Next slide. So let's look at this image here. We're going to take a few minutes to review a sample of what a Medicare Summary Notice looks like. The first page of your MSN will have your deductible status, your claims, and costs for this period, the total you may be billed, and the providers who submitted the claims during this period. Next slide. The second page of your MSN provides you with information on how to check your notice, how to report fraud, and where to call to get help if you have any types of questions. Next slide. Okay. So the next few pages of the notice provide you with detailed information on your claims. The claim information shows the date of service and the name of your provider, as well as a detailed description of what service was performed. Next slide. So the final page explains how to handle denied claims and how to file an appeal if you need to. For assistance in filing an appeal, you can contact your state's SHIP program, which means the Senior Health Insurance Assistance Program. And if you look at the top right-hand corner, it tells you that this is not a bill. So we ask that you just review it to make sure that everything on there is correct. Next slide. Okay, so now we're going to go to the EOBs, the explanation of benefits. If you are on a Medicare Advantage plan, this is what you're going to receive, an explanation of benefits, not a Medicare summary notice that we just previously saw. Your plan will send you one of these after services are received, okay? And we understand that this could be a little overwhelming. There's a lot of writing on this, but we ask that you try to look at it, and depending on the company that you belong to, the plan that you belong to, it's going to look a little different than this one. Okay, next slide. So, in reviewing your Medicare summary notices or MSNs and explanation of benefits or EOBs, we recommend that you use a personal health care journal or pocket calendar to keep track of all your services and equipment that you might have received. A healthcare journal is a booklet that allows you to keep track of every aspect of your medical information in one place. It includes a section for you to list your doctor appointments. You can record the date of your appointments, doctor's names, and their reason for your visit. You can also track dates that you have had tests on, or lab work, or x-rays on. Okay? If you don't have a healthcare journal, any type of book or little notebook could also help. Okay? Check for accuracy. Always look at the information to make sure that it's accurate. Check the dates of service and match it to your healthcare journal calendar. Do you recognize the provider's name? Did you receive the type of service that is listed? Lab work, x-rays, or other types of tests? Make sure that your provider charged you the correct amount. Were you charged more than once for the same service? All of these are questions that you should ask yourself in checking for accuracy. And if something isn't right or there's a discrepancy somewhere, try to get it resolved. And that's how you're going to be able to make sure that everything's going correctly with your different benefits. Okay, next slide. And now identifying potential fraud. This is very important. Review your MSNs or EOBs when it comes in to ensure that there is no unusual or suspicious claims. If you see something that you don't recognize, such as a provider's name or a date of service or a test that you know you did not have. If you're not satisfied with the answers that you receive from your provider once you call them, or if you do not feel comfortable calling them, you can contact us, the Senior Medicare Patrol, at 877-272-8720 for help. This is our job. This is what we do, and we're here to serve you. So this is one way, by checking your MSNs and EOBs, of identifying any potential fraud. You don't necessarily have to give out your personal information to have your number compromised. And this is the way you'll be able to detect if something is going on with your Medicare number and account. Next slide. Okay, so now that we've discussed what an MSN and EOB is and how you have to check for accuracy and for potential fraud, you are now going to hear from Keith, who is going to discuss the 3 keys to success from our program in stopping healthcare fraud, waste, and abuse. So Keith,
Okay,
turning
thank
it
you,
to
Brenda.
you.
Thank you,
You're
Brenda.
welcome. You're welcome.
And the first thing I want for you to understand is that you are very important in our efforts to stop Medicare fraud, abuse, and errors. And the first key that we talk about that you can do to help us is to protect yourself against Medicare fraud. And by this, we mean that you protect your identity. You never want to give out any information, especially your Medicare number, but this applies to Social Security, your bank account, anything. You should never give out any kind of information to somebody who calls you up out of the blue. Just, understand that Medicare and any government agency is never going to call you out of the blue and ask to verify your information. The way that they contact you is first with a letter, and that applies to Medicare, Social Security, or the IRS. And then they may follow that up after a letter with a phone call, but they're not going to ask you to verify, your information. And the next thing we want you to do is don't carry your Medicare card. And this applies not just to your Medicare card, but also if you are on a Medicare Advantage, not to carry around your Medicare Advantage identity card. And I know what you're thinking. You're asked, well, what about, in case of an emergency and I have to go to the hospital, I'm out of my home, and I don't have my information on me, what's going to happen? Well, understand that in any emergency situation, you will be admitted to the emergency room without your card or your number. And then later on, you can, have a family member or somebody that you trust to bring you the card, and you can fill out all that information. But you will never be denied access to an emergency room just because you don't have your card on you. So please don't carry that around with you, and also understand that if you do have a Medicare summary or Medicare Advantage program, they're going to need that card instead of your red, white, and blue Medicare card. So in that case, you really don't even need to take your Medicare card to the doctor if you have an Advantage plan. And as Brenda talked to you about, we really want you to keep a record of your medical visits. And we suggest that you maintain a journal, and in a few moments I will tell you how you can get a free journal from us, and we will send to you, and that'll be very helpful in keeping track of all of your medical information and your doctor's visits and that sort of thing. Okay, now if we look at the next slide, we will see that the next key is detect. And this is what Brenda was talking about, reviewing your either your MSN or your EOB, looking for things that shouldn't be there. And I want to emphasize the importance of this by giving you a real life example of something that happened to one of our volunteers. We have a volunteer named George who lives in a rural area, and a while back he had to go to the local hospital, and they determined that they needed to transfer him to the regional hospital that was about half an hour away or so. And they had ordered an ambulance to transport him. Well, his daughter had taken him to the hospital, and he said, well, I don't really need to ride in an ambulance. You know, my daughter can take me up to the regional hospital. That's not going to be a problem. So, you know, being one of our volunteers and understanding, you know, the importance of, you know, looking at your MSN and reviewing it, when the charges came for that visit to his local hospital, he saw that there was a charge for an ambulance. So he did what he was supposed to do. He called his local hospital and, you know, reminded them that he did not use the ambulance that his daughter had taken him, and they took the charge off. So that's a real life example of the importance of keeping track of everything that happens when you go to the doctor or the hospital, and then reviewing that when you do get your MSN. Okay, on the next slide, we will see that the third key is to report. You know, we always say that, and we know that you are probably always getting calls from people you have no idea who they are, and they're calling you and, you know, trying to sign you up for, you know, a back brace or whatever it is. If you should just understand that the best thing you can do is just to hang up when you get any kind of these scam calls. Now, if you do get a call, or if you, you know, like I said, if you look at your MSN and you see something and you try to resolve it through your provider and it's not, you know, you're still having problems, then we ask that you do call us. And we do have a toll-free number, and it's right there. It's 877-272-8720. And if you call that number, you will be able to speak with a live person, and they are more than glad to help you with, you know, resolving an issue that you may have. Or we also want to know if you are getting, if you receive some kind of a scam call or something, we would like to keep track of all of that. So please call us if you do have a situation, and we just really ask that you do report this. And on the next slide, maybe you are interested in, you know, being, you know, getting involved in helping in a more formal basis. Well, we are always looking for volunteers. And we just want you to know that our volunteers really make a difference. And just like I was talking to you about George, we cannot do our job without our volunteers. So if you're interested in volunteering, you can call us on that toll-free number that we will put up again, and you know, we will send you out a volunteer packet, and you can get more information, and you can find out what, you know, what's all involved. And there are several ways that you can volunteer. So maybe you don't feel comfortable in getting up in front of people and giving presentations. Well, we have a lot of things that volunteers can do that, so please give us a call if that's something that interests you. Okay, and then on the next slide, I told you about the free healthcare journal. So all you have to do is to call our toll-free number, which is right there. Please write that down, 877-272-8720, and just ask for that you would like to receive a journal, and we will send you one. And we also, you know, are on social media and on the web. So if you please, we ask that you, if you get on Facebook, to look us up. We have a separate Facebook page for each state: Georgia, Louisiana, and Mississippi. And we also have a Spanish Facebook page. And you can also visit our website. You can see that right there, stopmedicarefraud.org, and get more information. But please do call us if you would like to receive a healthcare journal. And I think at this point, I'm going to turn it back over to Sunny.
Yes, thank you, Keith and Brenda, for that valuable information on the Medicare summary notice and explanation of benefits, and the great information on our program and how you can help protect yourself from becoming a victim of healthcare fraud and scams. So coming up next month for our webinar Wednesday, we're going to meet and talk about preventing identity theft. So we're going to talk a little bit about just normal identity theft and then also medical identity theft. And we have a lot of really great information for you all. So we'll hope you'll join us. So save the date. It's scheduled for March 30th at the same time, 10:30 a.m. And just be on the lookout for more information on how you can register for that event soon. All right, so now's the time for our prize drawing. We have a neat little important documents case that you could keep some of these Medicare summary notices in if you hold on to them. I'll also include a calendar and one of those healthcare journals that Keith talked about and some other SMP goodies. So if you will give me just one moment, I will pull up our prize wheel. And let's see. Here we go. And let's see who our lucky winner is this morning. And you do have to be present to win. All right, Dr. Thomas, it looks like you are our winner today. And I do see that he is here, so he is present. So congratulations, Dr. Thomas. We'll get that out to you. I'll send you some information about it here soon, and we'll make sure that you get that. Okay. And just give me 1 second to get back to our presentation slides. Here we go. All right, so now is the time for us to open up the floor for questions. If you have a question about any of the information that we presented on today, please go ahead and raise your hand if you'd like to ask that out loud, and I'll unmute your line and you can ask our presenters a question. If you're not comfortable speaking through the audio, you're more than welcome to send us a chat or questions, and we can try to get to you that way. So it looks like Miss Betty, you have a question. I've unmuted your line. And it looks like you're self-muted, so you might have to unmute your phone in order for us to hear you. Let's see, that's Miss Betty Cameron. You have your hand raised.
Oh, yes, ma'am. I'm sorry. I just got this phone yesterday, and I'm not familiar with all the features, but I think I missed the first 3 minutes or so when I turned 65 in June, and so I will still be working part-time. So I wanted to know, someone told me that I only can apply for the Medicare A, I believe it is, not the drug plan or anything. Is that correct?
We actually don't handle the benefits and enrollment side of
Hmm.
things. We're strictly just
Uh-huh.
the Medicare fraud, but I do have a contact that I can give you for your local SHIP office, and they can help you with all of that.
Okay.
So what state are
Okay.
you in?
I'm in Louisiana.
In Louisiana. Okay, well, after today's presentation, I'll send you that information in an email.
Okay, thank you.
Sure, you're welcome. All right, I don't really see any other hands raised or any questions through the chat, but if you think of something, just go ahead and raise that hand, or you can send us a question through the chat. Okay, well, I'm not seeing anything else. So this will conclude our presentation today on understanding your Medicare summary notice and explanation of benefits. After today's email, I will send you a follow-up email with a link to a short survey. We would appreciate it if you would just take a moment to complete that survey and let ACL know how we did today. I've also just sent it through the chat. If you want to go ahead and complete that now, you can. As Keith mentioned, we're also offering a free healthcare tracker for those who attended today. I'll include some information about how you can get that in the follow-up email. All you have to do is reply with your mailing address, and we will get that out in the mail to you as soon as possible. So thank you again, everyone, for joining us today. And remember to save the date. March 30th will be our next webinar Wednesdays, and we'll hope you'll be able to join us. So thanks again, everyone, and take care and enjoy the rest of your day.